Good morning and welcome back to GP Video Podcast by Nadia. Today the topic that I'm going to start, and don't worry, I will be talking about PCOS and colon cancer in my next videos as well. But today the other topic that I'm going to start and will be carrying forward because it is a very, very important topic encountered by both kids and adults, especially the adults who are undiagnosed. It's called ADHD, Attention Deficit Hyperactivity Disorder. So if you have been diagnosed with it in childhood, then you can continue on the medications in the adulthood as well. But if you go undiagnosed, then still you can be diagnosed in adulthood as well. I'm not talking about the actual ADHD at this stage, but I'm going to straight away jump into the treatment part. So treatment for attention deficit hyperactivity disorder can help relieve the symptoms and make the condition much less of a problem in day-to-day life. ADHD can be treated using medicine or therapy, but a combination of both is often best. Treatment is usually arranged by a specialist such as a pediatrician if it's a kid or a psychiatrist if it's an adult, although the condition may be monitored by a GP. So once the pediatrician or the psychiatrist has prescribed the ADHD medicine and you've been monitored for a couple of months and you're doing well on it, then the GP can take over, can start prescribing it for you as well. There are 5 types of medicine licensed for the treatment of ADHD, and that's what my point of interest is, because usually what happens is initially what a medication is started, it doesn't work well, or if it works too well. So we should know both for kids and for adults that what are the classes, what are the groups of medications that are used for ADHD and what do they do, what are the side effects, and then one ADHD medication at least should be tried for at least 6 to 8 weeks to see how is it going. But if it's not working at all and giving you more side effects, then we can switch over to the other one. So we have a lot of options, so we don't need to worry about it. Okay. There are 5 types of medicines licensed for the treatment of ADHD: methylphenidate, lisdexamfetamine, dexamfetamine, atomoxetine, and guanfacine. Atomoxetine and guanfacine, which are the last two, I haven't seen them being used here. I don't know if they are available in Australia or not. Sorry, pardon me for my ignorance. But the first 3, methylphenidate, lisdexamfetamine, and amphetamine, and dexamfetamine. So methylphenidate, lisdexamfetamine, and dexamfetamine are the most popularly used medications for both kids and adults. These medicines are not a permanent cure for ADHD, but may help someone with the condition to concentrate better, be less impulsive, feel calmer, and learn and practice new skills, because these are all the issues addressed or faced in ADHD. Some medicines need to be taken every day, but some can be taken just on school days, depending on what medication you are using. Treatment breaks are occasionally recommended to assess whether the medicine is still needed. If you were not diagnosed with ADHD until adulthood, a GP and specialist can discuss which medicines and therapies are suitable for you. So as I said, if a kid is diagnosed as having ADHD in the childhood, they can continue, but also if one medicine stops working for them, we can also switch them over to the other group or see whether they still need the medicines or not. But if in adulthood you think you have got all the symptoms of ADHD and then you come to your GP, get referred to a psychiatrist, get diagnosed with ADHD, then you can still be started on medications. And again, the process can be started from the scratch to start you on one to see how you go. And if that doesn't suit you, then the other one, but something or the other will definitely work for you. If you or your child is prescribed one of the medications that I've just mentioned, you'll probably be given small doses at first, which may then be gradually increased, because every medicine that we use, we need to start it. I mean, there are some medications which are used in tapering dose, like this increase those first and then we taper them down, but usually the medications that we start them at the smallest dose, and then whether they are ADHD medications or whether they are BP medications, usually the rule is to start at a smaller dose, also to assess whether the patient is allergic to that medication or not. and then we can increment it up there. So you will probably be given small doses at first, which may then be gradually increased. You or your child would need to see a GP for regular checkups to ensure the treatment is working effectively and check for signs of any side effects or problems. It's important to let the GP know about any side effects and talk to them if you feel you need to stop or change treatment. Your specialist will also discuss how long you should take your treatment, but in many cases, treatment is continued for as long as it is helping. I have got a 69 years old lady who's still on treatment for ADHD, and if she goes off it, she does not do well, so she's still on it and she doesn't have any long-term side effects. So number one medication that we will start is methylphenidate. Methylphenidate. That is the most commonly used medicine for ADHD. I'll tell you from now what are the brand names, because you all know these medications by the brand names usually. So the brand names are Ritalin and Concerta, but I'll talk to you about that in a while, that like which one is Concerta, which one is Ritalin. So methylphenidate is the most commonly used medicine for ADHD. It belongs to a group of medicines called stimulants, which work by increasing activity in brain, particularly in areas that play a part in controlling attention and behavior. Methylphenidate may be offered to adults, teenagers, and children over the age of 5 with ADHD. So medications can only be started over the age of 5 for ADHD, while even the proper diagnosis of ADHD is also only made after the age of 5. The medicine can be taken either as immediate release tablets, a small dose is taken 2 to 3 times a day, or as modified release or extended release tablets taken once a day in the morning with the dose released throughout the day. So usually Ritalin is the brand name for the immediate release tablets, small doses taken 2 to 3 times a day, while Concerta is the modified release tablets taken once a day in the morning with the dose released throughout the day. So it's an extended release tablet. Ritalin brand, if it's Ritalin LA, which is, I think that is also long-term one, but actually Ritalin basically is the one that is the short-term one, immediate release one, and Concerta is methylphenidate, which is the extended release one. Common side effects of methylphenidate include a small increase in blood pressure and heart rate, loss of appetite, which can lead to either weight loss or poor weight gain, trouble sleeping, headaches, stomach aches, feeling aggressive, irritable, depressed, anxious, or tense. So these are the side effects. Especially the ones that are troublesome for kids are poor weight gain, and could be trouble sleeping, headaches, stomach aches, also feeling aggressive, irritable, depressed, anxious, or tense. And if these symptoms are all troublesome, we should let our GP or the specialist know. And then again, as I said, after trialing it for 6 to 8 weeks, it can be changed into the other one. But yeah, so we'll come back to the other options tomorrow. Have a great day.